Hello, this is Dr. Brian McDonough. Very important news today, answering a question that I've been wondering about for quite some time. Let me bring you back in history a little bit. I was on the Sean Hannity radio program early on in the pandemic. And let me say something about Sean. He brings on guests, he allows them to speak, and he respectfully listens. And sometimes you have debates, but it's a good discussion. But I was on the program talking about COVID and that whole concept of herd immunity. And my argument against herd immunity was you're talking about a very high death rate with COVID. Now, this was before we knew we'd have 5 million deaths in the world, and as of today, 745,000 in the US. I mean, this was early on, but you knew this thing was far deadlier than it was being talked about. It was quite obvious. But the other thing that was quite obvious to me was when experts talked about herd immunity, and I was debating an expert talking about herd immunity, they were acting as if you would get lifetime immunity. And I kept saying, I know this is early, but we're talking about a coronavirus. We're talking about a virus that will mutate. It will change. So any immunity you get isn't like getting immunity against something stagnant. It's going to change. So the whole idea, first of all, of losing so many lives to try to get everybody immune was devastating in and of itself, but it was also a flawed theory. But I've kind of had to wait to be justified. Not that I'm a genius, but it just seems so logical. And like I said, I'm glad I was allowed to express my opinion because at least people got to hear it and make their decisions. And remember, this was before the vaccines. But there's a report now. The CDC has come out and they've taken a look, because they can, at people who have been vaccinated, people not vaccinated, and those who naturally acquired COVID. Now, according to this theory, if you got COVID, you're just protected forever. Get through it, and you're protected. Well, the reality is quite different. In fact, if 90 to 180 days ago you got COVID and you somehow and luckily survived, versus someone who got the vaccine 90 to 180 days ago, you're 5.5 times more likely to be protected by the vaccine than the naturally acquired COVID. In other words, you got COVID, and nobody wants to get COVID, but you got COVID, it doesn't even give you that great immunity that the vaccine gives you. And that's an important point, because some people have said, well, if I'm young, I'll get COVID and I'll get through it and I'll have this great immunity. No, you won't. It's not as good as this mRNA vaccine, which can protect you. Another very important point, we don't talk often about the side effects of the survivors. Just saw a report, and I'll make sure it was in the journal Nature, and it was talking about tinnitus, which is ringing in the ears. Well, that's being recognized as a devastating side effect of people who get through COVID, one of those long COVID symptoms. And that is annoying. If you've ever been at a concert or been out with a crowd and you come home and you got that ringing in the ears from so much noise, not only can it potentially cause hearing damage, but it also is just annoying. It usually goes away. But with COVID, it's lingering. So again, if you get this virus, you're going to get these side effects that we're not really focusing on because we have so many people dying. I think it's also worth thinking about. So just a summary here. We finally have the information, something we could intuitively say. Those of us who practice kind of know these things, but I think it's an important point to bring and to share with you.